when it comes to neck pain and back pain, multiple things can what I'd call an etiology or the cause of those symptoms. Certainly stress can be one. Lack of activity or being more sedentary is another. And then there are also patients who have real pathology, who have real disc degeneration, disc herniation, pinched nerves, etc., that may also lead to those symptoms. The pandemic, unfortunately, there was a period of time in which patients, and rightfully so, had chosen to stay home, social distancing, which is very appropriate, but they didn't really have the guidance or weren't able to get the guidance necessary from us as physicians in order to address their symptoms. We're fortunate that we have telemedicine in our practice. We're able to execute it relatively quickly in order to reach out to our patient base, to educate our patients as far as how to address the symptoms that they're having. We're also very fortunate to introduce telephysical therapy, which allowed our physical therapy department to work with our patients through telemedicine or through using the camera and whatnot in order to continue their care. And once some of these restrictions were lifted, we were then able and fortunate to be able to see them in the office. Now, I have to tell you, we're fortunate that we have these technologies to be able to communicate with our patients, but I can tell you that it's still a challenge to be able to provide the full gamut of treatment for patients without actually being able to lay hands on a patient. I don't think that telehealth will completely overtake or replace what we do in a physician's office, but I think it is a paramount part of our armamentarium to treat patients. And hopefully over these past several months, we've been able to establish that this is something that needs to stay and be available. I think a lot of our patients are appreciative that we have it available for them. And I think it's also a great option for those patients who are, say, living in very rural areas or hard to reach areas. With the pandemic, some of the restrictions that were placed on telehealth were fortunately lifted, and hopefully our legislatures, our representatives were able to see the value and will allow us to keep this avenue of patient communication moving forward.